Welcome to our Convergence in Health and Wealth and Retirement conversation today. We have an all-star panel, and we're very excited to talk about the changes that are taking place in the marketplace and give us an opportunity to think about how this shift may impact your practice and how to approach the competitive landscape that's changing the industry, and how do we adapt, and if we need to adapt, and ask some questions of our all-star panel today about how they're dealing with this trend in the marketplace. And I'd like to introduce a few folks on our panel today. Nate White is the founder and managing principal at Terros Advisor, a One Digital company in Northern California. Nate's got some great experience building a team and a practice, but also being tied to an employee benefits firm in his past partnerships, as well as in his future partnership here with One Digital. Also, Casey Skittle is president and retirement plans at Summit Financial Group. Summit is a Dallas-based independent employee benefits firm specializing in health and welfare and retirement plans and individual wealth management. We also have Tom Brown, who's a partner and wealth manager at Blue Water Capital Management, Blue Water, Syracuse, New York. It's an SEC registered investment advisor firm that specializes in individual retirement plans and third-party wealth management. You'll notice I didn't say employee benefits there, Tom. So let's jump into it. Casey, you go first, ladies first. Please give us some just additional insights into kind of this shift as you're seeing it in the industry. And I know you guys have probably been doing this for a long time around the employee benefits, retirement, and wealth space. Why and how are you working towards this kind of holistic strategy in the marketplace?
Well, thank you. Thanks, Vince, for asking me to be a part of this. And it's a real honor to get to talk to everybody today. Really at Summit, we're fortunate because we are a benefits practice and we have a team of consultants. We kind of focus in three areas: anything benefits, insurance, or investments related. So we do naturally align on the health and welfare side. We don't have to do the external referring. We have that in-house expertise to provide solutions. And one of the great things we were able to do is during COVID for 6 weeks straight, we would have one of our practice leads from each of the areas I referred to that was able to actually share with our clients. So that has been a real benefit for us. And I feel like, Vince, our clients charge us with knowing everything in those different areas. A few years ago, we did choose to grow our individual wealth management side of the business to make sure that we were providing that structure as well. So we believe that overall that one size just doesn't fit all, and with the commoditization that often comes within the industry, we're trying to make sure that we solve for that problem.
Muted, Vince.
Thanks. And I saw Casey even making the motion, and I didn't even think I was wrong with Casey's ear. So just from what I understand on your firm, taking a more traditional approach around the RIA and some of the services that you provide, just share some of your thoughts around the convergence of how you see these changes playing out. Now you're on mute.
Sorry about that. So Blue Water is independent and specializes in investment management, financial planning, and the management of retirement plans. So that's how we like to position ourselves, as the experts really in those fields. So when we talk about the traditional approach, we're referring business to the other areas like insurance, employee benefits, payroll, accounting, things like that. And we see ourselves more or less as the trusted advisor, getting to know the client, and then going out into the world as an independent and choosing really the best fit for our client. The convergence that we talk about is really what I believe to be kind of a natural genesis, right, of these referrals. When you refer a lot of business to a particular to another business, at some point in time, it's going to hit you in the head and go, hey, we should probably merge or acquire or have a discussion about that. And that's what we're seeing today. Again, really as that natural genesis of the traditional approach. The issues that we have and why we haven't really stepped hard into being more all around holistic is we feel that there can be a slight erosion of independence. Okay. So if we're heavily involved in the retirement plan space, working with participants, we work well with a particular record keeper, and then we merge with that record keeper. Well, we're kind of locked in, right? We have to continue to use that record keeper because they're part of our business. One of the things that we can do is be completely independent. So we can evaluate our clients' needs and go out and choose the best record keeper or insurance provider or employee benefits provider. And I think that in this shift that we're talking about, where companies are kind of coming together, the big question I would have is, are you creating a company that has truly independent divisions? So under the umbrella, you'd have Blue Water, but Blue Water would still go out and kind of find the best fit. Or are what we see the shift and where things are going is you're really creating these big conglomerates that really start to rely heavily on marketing and internal referrals to us. That in our fiduciary brains, it raises somewhat of a conflict of interest in certain areas. One of the things, being from Central New York, go Syracuse, is that it has resulted in a really kind of a different beast when you talk about competition, right? So now I have employee benefits providers that might be doing group term insurance. But if they're part of a bigger organization, they're talking to my plan sponsors about how they can manage the 401k. So for us, that's been kind of one of the things that we have to be very cognizant of when we talk about convergence in particular in this area.
Excellent. Yeah, those are great points, Tom. Nate, and it looks like to me like Casey, you've got all this already packaged up. Tom, you're acting kind of as that independent, maybe bringing best in class solution as you see it, or introductions to the table. Nate, you've been inside of a employee benefits practice where you were the 401k guy. You took that and spun that retirement practice off to be an independent on your own, building your own team. And now you're inside of One Digital, part of this overall structure with kind of a human capital management approach, which includes EB and retirement. So I know your organization is, excited about the future, but why did you make that choice, and how did you anticipate, joining with a benefits team and the impact to your retirement plan business?
Yeah, thanks, Vince. And, I've had a lot of experience with employee benefit partners over the years, and, always found that was obviously a natural progression to discuss retirement plans alongside health and welfare benefits. You've had many of the same decision makers, but not always. So that was, really kind of, as you said, how I kind of started in this business. And when we spun ourselves off, we had, I don't think it was for us as much of a thought of, well, this doesn't work with the benefits firm. I think it was just more of our own situation. In fact, we felt that it was still critical to our growth for the future. I think we were most excited for the partnership with One Digital, and I think again with someone that was truly kind of committed to getting into the retirement plan space was really threefold. Number one was the overall technology and scale that could be achieved. I think, as Vince, with resources, we have some phenomenal member firms, and we have some unbelievable tools that are available to those member firms. But I think, when you get to a larger organization that has a lot of those other capabilities that can further enhance what we do in the retirement plan side, to me, it was really a no-brainer to go through. And certainly understanding One Digital's culture was important to us. But beyond that, I think it was as we started to look at where the market's been going, how we are interacting with our clients, and how we partnered with our benefit firms, we found that there was becoming a deeper and deeper integration. That we did see, we saw the finance team getting more involved on the employee benefits side, which you didn't necessarily see in the past, because these became bigger and bigger dollar items for the employer, and then they were looking to us to really coordinate, the benefit spend, and I think having an alignment with our new partner in One Digital, and having a common story was really important going forward.
No, that's excellent. So maybe I'll throw this out there. So as this kind of holistic approach plays out in the marketplace, like, I think we all talk about breaking down barriers between health and wealth and retirement, and how does retirement, we've seen this at multiple conferences over the last, 2, 3, 4 years, where we talk about if someone is really financially better off, it impacts healthcare, right? You're more likely to have a heart attack if you're under financial stress than not. Like, you're facing anxiety, depression, obesity, different things like that. So I think that there's some linkage there, but it's always kind of a struggle, I think, to say, well, I've got an employee benefits producer over here, and I've got a 401k advisor over here. How do we really get them together so that the client experience is better? So Casey, I might tee this up to you, but how do you see that really from your company's perspective and the deliverable to the client? What are some approaches that you guys are taking, or challenges that you see working in this kind of like converged environment where you have all three of these offerings?
Sure, no, and I think some of Nate's points were just in tandem with kind of where we stand on that. Kind of to the point that Nate had said, is HR has always been the one that was more focused in on healthcare, and then our CFO was typically the person that we were dealing with. So we internally make certain that if we can get all of those parties around the table, we had someone in our office actually yesterday that we're talking to, and we had all three specialists at the table talking with them about how can we put all of this together, because they said we have X dollars that we can spend on our benefits, and they consider in all regards that's actually usually like all the benefits, but healthcare is the primary. And so ultimately, if we can't get them to collaborate internally because they have those competing interests, we actually are going to be challenged overall. And I feel like a lot of times it means the retirement plan is the one that kind of gets the back seat, right? They don't have a choice on their healthcare. Every year they have to pay for healthcare, and they have to figure out ways to do that. So that's just not a choice. So if anything's going to get stretched or depleted, it's usually going to be on the retirement plan side. That's where you often see kind of the first place that they go to. But really it's bringing it together. One of the clients, another client that we have, very large, we do a lot of consulting for them on the benefit side, and they've actually asked us to come in as the retirement plan specialist and talk to their employees about Social Security. They have more and more people getting toward the age of 65. So they're asking us to help them on Social Security. They've asked us, well, do we have a Medicare specialist? And I will say we used to. We had an internal representative that used to do Medicare. We chose not to continue with that path, but that is another place that people are asking. And so that's our charge overall as retirement plan advisors. We have to be able to help them with Social Security, with the Medicare, with the individual planning as well. So I think that's a big piece of what we've got to do.
Great, Casey. Nate, are you seeing this? I mean, I know your relationship on the One Digital side is fairly new, since the beginning of the year, but are you seeing that with like HR consulting and One Digital? What's your, I guess, client experience, or how is that working for you?
Yeah, we definitely are seeing it. I think, in all new relationships, there's kind of that feeling out period where everyone wants to kind of understand what everyone does. But, nevertheless, we're seeing the employer and the employees, the participants, coming to us, needing help. And, if you're thinking it from the employer standpoint, they have, like we said, the benefit, dollar spend. They have their own metrics that they have to achieve on that side, and they need help, and they want to see us draw those lines across, these two important benefits. Too big, and then you have the participants that are dealing with their own stresses. Obviously, this year is unique to none other. But we have financial stresses that the employees are dealing with, and all of that can lead to health issues. So those employees are really asking for the solutions, and that's certainly why we've seen such a big uptick in wellness solutions in the market, and why we offer our own proprietary solution, and why we're really putting a lot of focus there, because employees need that, and we know that's going to try to drive better health outcomes. And, I think as we've seen some of the numbers, it can cost an employer upwards of $50,000 a year for delayed retirement, for each year of delayed retirement. So it's a tremendous cost, and both sides, the employees and employers, are really asking for those solutions. So you mentioned HR. I mean, that I think is just another overriding component to this. Of how can you help the employer and the employees really get the most out of the plans, and have their employees understand the benefits that they have in front of them.
Great. Tom, at Blue Water, so you described kind of being this still part of the relationship, right? But you're including alternative EB folks or maybe HR consulting folks to kind of come in and help. Do you find yourself running point then on the relationships? Do you find challenges in sitting around the a common table with the client? Tell me a little bit, maybe, I guess, how you position that in the marketplace, and what you're modeling that benefits the client there.
Yeah, so I think that the standalone model in and of itself allows us to be, again, super independent. So again, positioning ourselves, if we're talking to an employer, we are the 401k or retirement plan experts. That's what we're going to do. Oftentimes we don't get asked to, what should we be doing on the health side, or the group disability, or the group life, or HSAs, or things like that. All of which we may bring up. Our one of our creeds is keeping it very, very simple. A lot of times when I'm meeting with an individual client, bringing up the ancillary things, and when I say ancillary, I mean anything that's not investment management or financial planning. It's difficult. It's a difficult transition, and I think in many cases it does confuse the client. What are we talking about here? Yes, we do have other issues, but we again want to position ourselves as that investment expert. I guess we think that if you do a good job of starting early and investing well, that's going to take care of a lot of that ancillary stuff. You might not need the life insurance at some point. Your health should be good because you'll have lots of money and you'll be less stressed out, if you will. A good healthy retirement starting early, you're going to be able to retire on time. So we're looking again for those better participant outcomes. So I keep hammering that, and really it allows us, if we can refer to an expert in employee benefits, well, that's going to free me up, right? It's going to free our resources up to really take that deep dive and make sure that we're crossing all of our T's, dotting all of our I's when it comes to investments and long-term financial planning. So that's why I feel, kind of that standalone model, it works the best for us and is part of, our growth strategy.
Excellent. We talked a little bit about the connection between kind of this health and wealth, right? Or at least health and financial stress in people's lives. And I think that there is a little bit of crossover. I mean, we can talk about wellness, financial wellness, and how we bring that. And health wellness solutions have been around for a lot longer. But there is kind of like this middle ground that's occurring in the United States. a lot related to kind of like HSAs, right? Like that's kind of like in no man's land right now. Like, or maybe it's not no man's, the benefits firms own it today, right? Because it's a way of mechanizing claims payment in a very tax efficient way to do it. But at the same time, is that a actual financial tool to really help people across the finish line at retirement? Because we know retirement medical expenditures can be a considerable amount of your retirement budget. So maybe I'll drop this out to Casey's with some of the financial group and how you guys deal with this. But basically, if an employer can initially contribute to an HSA to help their employees have money, so there could, a lot of these employers are doing 401k matches, right? So like, is there a mechanism there that HSAs become involved in that employer side, and then what role does that really play into the participant or employee side, Casey?
Yeah, well, I would say it's a great first step, just the fact that we have HSAs. And I do believe personally that the retirement plan advisors are actually the appropriate people to speak about the investments. But while we are the most appropriate person, I agree with you, Vince, it does fall to the benefits. And I know even with our own team, we have kind of internal struggle. I'm sure, Nate, you deal with this as well, is, you want that collaboration, but it's also one of those things that as our benefits experts, they're like, well, we're offering the high deductible healthcare plan, because to them, that's the key. But the bolt-on is that HSA. And so if it's with Blue Cross, it's whatever they have. If it's with if it's with one of the BUCAs, it's whatever they offer. That's what the HSA is. They don't really consider what the investments are on the backside, or if it's anything other than, our employees in plans, if you think about that, the employees aren't even educated sometimes to know that there is a mechanism that is available. So I think, the positive step that I feel like some of the record keepers have taken, not only that they have that healthcare estimator, they also are starting to have like an HSA provider that you can pair with. But to your point, I actually feel like it's still kind of the wild, wild west. And I think of the 403B plans where in Texas, California, there's holdout states where, all these different providers could be with the 401k plans, 403B plans. It's similar. It's just so disjointed. So I think the challenge is that goes back to kind of the overall point is, we have to be collaborating and in those meetings. Otherwise, it's causing a little bit additional stress. We know the margins are thin as retirement plan advisors. Like, is it worth it for us to do it? But then you look on the other side of it, and I feel like there will be an opportunity. I know that the healthcare side is starting, their margins are shrinking too. We do more and more consulting, less and less of the brokerage type stuff now. So I think that's something to consider going forward, and how we can all make some lemonade out of lemonades. I think I said that right. Some lemonade out of lemonade. So that's what I'd say.
Yeah, no, I think that's a really good read, Casey, on it. And these are all kind of like pieces of a puzzle, right? So it's like, how do they all kind of fit together? And again, another component of this is really that we see in the marketplace is advice. Right, more and more people want advice, and this is a very interesting thing. From the financial services side, we've seen, like, from an asset management, robo advisory services come up, right? But ultimately, people wanted advice through people. They want to be able to talk to somebody at some point, and so we've seen the robo people add advisors, and we've seen online 401k vehicles kind of come and go, and so. These are always really challenging things, because we want to automate, self-serve. I think people want customization in the marketplace, but at the end of the day, when you're dealing with someone's emotional tie to their money, they want an outlet that they can reach someone. So, just curious, Nate, just on kind of like the financial stress and trying to provide financial advice. What's your team doing relative to the participant level advice? And what requests are you getting, and what are you willing to do?
Yeah, it's a great question, and I think is the ultimate challenge for us as advisors is how do we get to everybody, right? how do we touch the person that has, no retirement plan savings? They're not in the plan, they're not participating, but they maybe they need to, but maybe they have other financial stresses. How do we touch that person versus, who everybody is focused on in the past, the CEO, the CFO, the COO. You've always had, the ability to focus on those individuals because it was profitable for you. So, that's where I'd say the technology is critical. You have to leverage the technology, but, you also mentioned, having the human interface. You have to bring that into the mold as well, because we just don't see the adoption rates if you have just tech trying to get people to do the right thing with their finances. So that's where we've adopted and really jumped into the wellness side. And, our wellness solution is having that human interaction, but also the technology to be able to work with all the employees of a company. So we let the technology work for us at the smallest level to help those employees, whether it's emergency savings or dealing with student debt or whatever those financial stresses are that prevent them from being in a retirement plan. Let's work with those individuals outside of the plan, first get them on the right path, and then, perhaps one day they can start thinking about saving for their retirement within the employer-sponsored plan. And that ends up being, I think, the way it makes us feel the best about what we do, because we are really trying to help everybody, not just focus on those with higher account balances. And, and then, we'll of course have the solutions for the higher account balance individuals. So that's where our advisory team is really able to dig in on all of those areas with the employees, wherever they are on that continuum, and, try to just help them take that next step, whatever it may be.
Yeah, very interesting that wealth management or wealthy clients never seem to be, stressing over how to find a wealth advisor. So wealthy people tend to find a wealth advisor readily available, but it is the general population that doesn't have the expertise, and oftentimes, I mean, we've seen survey after survey that says they don't actually believe they're wealthy, right? Even people with $250,000, $500,000 of investable assets oftentimes don't consider themselves wealthy and not approachable to a wealth management person. But I do think that there is a connection here around people wanting advice through an employer and wanting. My own firm, we've always kind of embraced the wealth management aspect, right? And so we see it as a value added tool and deliverable to the client. So, firms that offer retirement and wealth seem to be, those things seem to be more interlinked in the marketplace than this kind of maybe new branch into the EB space. But Tom, you guys are squarely in the wealth management side as an RIA and providing those kind of services. Is there a connection between retirement plan conversation and the individual kind of conversation that you guys are having?
Yeah, thanks, Vince. We've got about 30 seconds left, so I'm gonna hit this hard. Our business model has started to transition, I would say, about 8 years ago, to taking over corporate retirement plans, which creates markets of participants. Once we get those markets, we roll up our sleeves and we go meet with every single employee on a consistent basis throughout the year. It's just hard work, right? From there, what we do is we convert them into individual clients using maybe outside assets, or if they're in a transient type of business, we collect their rollovers. There's a number of different ways in which we convert them to individual clients. That's our business model, to the point where 10% of our new clients 8 years ago were coming from just hard networking in various segments of the market, to now probably 40 to 50% of our new clients are acquired through our 401ks.
Excellent. Well, Tom, as you mentioned, we're coming to a close here, and really appreciate everybody's time. Casey, Tom, Nate, thank you very much for taking some time this afternoon to go through the story of Convergence. And really, I think you guys just did a great job highlighting even the independent areas, right? EB, wealth, and retirement. And we're really looking forward to seeing what the future holds in this kind of story and how it plays out. So hopefully everybody got some really good feedback from it, but we thank you very much today.
Thank you.
Thank you.